you very much, Jagat. Good morning to all of you. Professor Saman Nanakara, the Dean Faculty of Medicine, University of Pegadiriya, Professor Nanakara, the President of the PeMSAA, and all invited guests from other hospitals and Faculty of Medicine, and the Dr. Jagat Ranasinghe, the President of the Clinical Society Nawalapitiya, and the council members, all consultants, my dear doctors. So I think I have to do two objectives now, and first my opening remarks. So I would like to warmly welcome all of you to DGH Nawalapitiya. So I think it's highly appreciated that we are jointly working to enhance, upgrade the knowledge of our medical profession. So always you all are welcome for this kind of activities. And without taking much time, so actually I have been given 15 minutes. So first I would like to thank Dr. Jagat for inviting me for a lecture. I'm a management specialist. I'm not actually, even though I'm a doctor, I'm involved in management. I'm a healthcare management specialist. So I will be speaking about a management lecture actually. So I think this is very common in this setup as well as in the country and other institutions as well. So my title is From Tension to Teamwork, Resolving Conflict in Healthcare. So I will be speaking conflict management in healthcare. So I think without taking much time, so I think you can see a few news reports we have seen in the past. So one of the incident happened at Kurunagala Hospital. So where there was a fight between our medical colleague and a nurse. Initially it was an interpersonal conflict and then became an inter-group conflict. So there were litigation issues, legal issues as well as ministry inquiries. And there's another one, I think still we are experiencing the conflict among midwives and labor room nurses because of their job roles. And there's another one happened I think about 2 years back, the fight again with the doctors in Nawalapitiya Hospital. So, and this is the incident happened again few years back at Nawalapitiya Hospital. So you can see how common these conflicts are. So ultimately these are becoming physical fights as well. So I think the recent conflict, I think you all can remember the incident happened at Ratnapura Hospital. So I will show you about 3 media reports. The one, doctors claim unfair treatment following life-saving efforts. So again, this is a conflict happened in the hospital. So these are the other, the headline, disciplinary investigation into 3 doctors who went to perform a cesarean section. And this is the there are how it reports about this conflict inside an institution. So what do you think? Now working together, is it easy to working together? I think it's not that easy, isn't it? Even as a husband and wife, even in a family, even in the society, even an institution, it's not that easy to working together. So we have to understand there's always chance for conflict. So that is a common incident in this. This is a common incident. So what is a conflict? How would you describe it? So now, according to dictionary definition, it's a disagreement, struggle, fight, or incompatible. So if I go for another simple definition, conflict is all kinds of opposition or antagonistic interactions, all kind of opposition or antagonistic interaction. So this is going to be a more management definition. It's a disagreement between 2 or more organizational members or groups. Now you can see it's a disagreement between 2 or more organizational members or groups. So a conflict can be among 2 members, or it can be converted to inter-group conflict. So the fact that they have different goals, so that we have to understand. So as a hospital, so we have a common goal, we have a vision. Our vision is perfect patient care filled with human kindness. So once you come to this hospital, so you all have that common goal or common agenda. So we know personally, we have personal agendas, personal goals, but when you come to a common, an institution, so you have to align with the common agenda. So when there are different goals, definitely there will be conflict. And statuses, what are the statuses? Now, in the faculty of medicine, now we have the dean sir here. So he's the head of the faculty. So he has department heads. So department we have senior lecturers, junior lecturers, other demonstrators of various professionals. So there is a management structure. structural hierarchy. So always there is a status. So we have to understand the status of each and everybody. Then it's easy to maintain the peace inside an institution. So I think in Ratnapura also this is one of the issue where the status issues were the one of the causes for this conflict, and also values of perception. So we have different values and perception. So I can remember, I mean, when we had the musical event inside the hospital few years back. So few of our categories were bit against that because they have different values. So they don't want to have musical events inside the hospital, but other people they do want. So we have to manage it. So likewise, those are the major causes, and all from the fact that they have shared scarce resources. So that is one of the main cause. The resources are limited. So in a hospital settings, in health sector, even in the medical faculty, the resources are limited. So say now we are having a limited theatre time. So sometimes even consultants can have conflict because the resources are limited, theatre times are limited. So you have seen even Peradeniya Hospital, how many conflicts happen due to the problems with the accommodation facility, restroom. So those are the main factors, and also sharing the work activities. In a hospital, you can't function alone. So hospital is we have administrative structure, we have clinical structure, we have supportive services, we have utility services. So all are interdependent. So if the laboratory is not providing investigation on time, so there would be conflict with the laboratory staff and the clinical staff. So those are a very important cause for conflict. So this is one of the management definition. And you can see the causes in summary. And conflict traditional view. So we talked about the conflict in the past. These should be avoided, and these are destructive always. So we have to eliminate conflict from the institution, and we have to eliminate the troublemakers from the inside. And according to the traditional view, so whenever there is a conflict, so the productivity will go down. The productivity of the institution will go down. But now when we are talking in the modern society, the aspects are different. So conflict modernly means conflicts are unavoidable and caused by individual differences. Maximum productivity requires moderate level of conflicts. Absence of conflict undermines the productivity. So that we have to understand. If there is no conflicts, means that institution is not progressing. So there are problems inside the institution. So we have a lot of examples to take, but I think with the time, because of this time limitation, I am not going to tell these things. So if there are no conflicts, meaning the institution is not progressively developing. So that also they have to keep in mind. So this is how we are explaining the modern the theories behind the conflict. So you could see the moderate level of conflicts. So those are called functional conflicts are benefited for an institution. So the productivity would be maximum. And level of conflicts, intra-individual, we can categorize as intra-individual, interpersonal, intergroup, and inter-organizational. So now if we talk about the causes, so it is very important to understand role and status issues. So everywhere these conflicts are most of the time occurring because of the issues with regard to the role. So if somebody is going to do somebody else's role, there would be a conflict. So that we have to keep in mind. So administrators will have to do their role, the clinicians will have to do their role, and other staff, matrons, so everybody in the hospital, they have to do their own roles, they have their job role. Somebody is going to interfere with the functions, so that is a reason for conflict. And status issues, as I mentioned you, so we have a hierarchy in institution, maybe in private sector as well. So always you have to think about the status and hierarchy of the institution. And other thing is the resource limitation. So this is one of the major cause for conflict when there's a scarce resources. So always there would be conflict. So I can remember there were a number of issues happened in this hospital because of this resource limitation. So always we have to keep in mind when we are managing the conflict, what is the causes. Another thing is the change management. So most of the time it's very difficult to change our people. Whenever we are going to start the change, so people will be against that. So I can remember a few years back, we want to start appointment system in our medical clinic. So our SHOs were against that. Ultimately, they came up with the consultants and we had to stop it. But anyway, I have to be thankful to our current team. So they have started that and we are progressing with that change. And also, clashes between values and interests. I said to you again, this is one of the causes for conflict. And misinformation, assumption, and expectation. So this is also one of the causes for conflict. And aggressive or competitive behavior of human beings. So as I mentioned now, we saw how many fights happen. So even in institution, there are, difficult customers. So we have to understand their behavior, their aggressive or competitive behavior. So this is also one of the reason for conflict. So and the frustration. So for example, few weeks back, actually 1 month back, we had a issue, and people have posted the post against the hospital in the FP because they have gone to the radiology department and they were waiting for more than 40 minutes for X-ray. So they were frustrated and they have made a video and posted in the FP, and ultimately we had to go to the police and we have arrested that one. So they have a big issue. So likewise, people are unhappy if we can't do their services on time. So we have to do the prompt attention as well. And consequences, as I mentioned now, I mentioned that so moderate conflicts are needed for a progressive development of institution. So you have good consequences as well. Increase creativity. So whenever there is a conflict, so you are more prone to develop more solutions, new solutions. You can come up with creative solutions for conflicts. The other thing is now people have opportunity to clarify their views. Sometimes we have seen with the conflict only, we know that there is an issue going on like that. So it's very important to get that issues in the hospital. And you can produce a constructive social change. So you can remember what happened in 2022. So after the Aragale, so this kind of things happen. And it gives people the opportunity to test their capacity. So you don't know, whenever you are isolated, you don't know what is your capacity, but whenever you are facing a conflict, you know your capacity. So I faced this year, at the beginning of this year, from the, with the kind of local politicians. So, but anyway, now with our hospital as a team, I realized what is the capacity of our hospital as a team. So conflict can have development of groups and organizational cohesion. So these are the good consequences of conflict. And bad consequences, violence. So we have seen violence in most of the institutions. So people can't tolerate, people can't talk, people can't communicate, but they, instead of that, they will go for fight. So this is one of the bad aspects. And also breakdown of relationships. So it's a bad consequence of conflict. And destruction of communication, elimination of coordination. This is one of the bad aspects of conflict. And polarization of views into static position. So whenever there is a high level of conflict, people don't want to negotiate. You want 100%. So if you want to settle this person might have to leave the place. So likewise, they will demand. So this is one of the bad aspect of conflict. And encourage authoritarian type of leadership. When there are two parties involved in the conflict of an institution, head or maybe the manager will take the authority and suppress the conflict. So there is a bad aspect of conflict. And divert attention and energies away from the major institutional goals. So actually, beginning of this year, I had to face number of audit issues. I said Jagat as well. So because of that, I had to personally struggle how to overcome these issues. So I was disturbed to development progress of the hospital, and I was planning to have a four-story building for this hospital. But because of this, it was delayed. So ultimately, we couldn't include it in this budget proposal. So these are the bad aspect of conflicts. And low morale and unity is one of the bad consequence. And always there is a cost for conflict. So relationship cost, that's a cost. So if you are going to have conflict, definitely you are going to lose relationships. And cost to the individual. So you have to have stressful life. You have to spend your energy. You have to spend your time to manage conflict. This is not your objective. And also cost to the organization, as I mentioned. So if you are involving in a conflict, you need not to have a time to develop or do your duty properly. So those are the things. So how can we manage the conflict successfully? So always have active listening and I would say discussions. So whenever we are having issues, I used to have stakeholder meetings. We all have to have a meeting and we have to discuss. So what are the issues? So we have to listen to the people and get their ideas. And we have to do the active listening and empathy. Always think about others' feelings, how they are feeling about these issues. So this is very important. And other thing is now we are using mainly 5 management techniques to manage conflicts. So one is I would say is avoidance. So sometimes there are conflicts you need not to solve. So in some conflicts which are not going to affect the day-to-day function of an institution. So why I want to take unnecessarily those conflicts to be managed. So you are not going to take that conflict, so you are going to keep it in a side. So that is one of the techniques. So whenever some people are not going to give answers for something, think about that technique. So managers also sometimes they don't want to do anything. They put it is called as avoidance. So you are avoiding. You are not take it as an issue in an institution. So that is one of the technique. And other thing is now now we are using two aspects. Now say if you have concern towards yourself is more, you are going to use one method. If you have more concern towards the other party or relationship, you have to use another method. So now just think about this one. Now if you are going to think about yourself, you have more concern towards yourself, always you try to get the win situation to yourself. That is called competition. So where one party is going to lose, one party is going to win. So that is one of the techniques that is called competition. And if you have more concern toward the other party or towards the relationship, you are going to get the lose and you are going to give the win to the other party. That is called accommodating or giving in. And if you think that both parties are very important, so you can't have problem, so you will go for compromise. So both parties will half lose, half win. So that is called compromise, where you go for the middle or the modest solution. And the best management technique would be the cooperation or collaboration, where both parties will go for win-win situation. So we are going to have creative solutions for conflict, and we are going to go for a collaboration, that is called cooperation or collaboration. So you can see whenever you have concern for self is very high, so you will get the victory for your side. If you have more concern towards other party, you will take the defeat for your side. But if you both want to get a good solution, so you will go for cooperation or collaboration. So we always encourage a win-win situation in conflict. So we have to keep it in mind. Always we have to look for a win-win situation. So I will conclude my lecture with this take-home message. So I think you all know the famous story of two donkeys. So two donkeys were tied together by a rope, and they were trying to eat this grass. So, but they didn't have any communication, they didn't have any discussion, they tried to eat, but ultimately both failed. Then what happened? They sat together and they introduced each other. And then they decided how they are going to overcome this issue. And they got together and get turns. They got turns and they finished the grass. So this is how you have to settle the issues. Thank you very much.
Thank you, sir.